Also, Health and Human Services Secretary RFK Jr. today moving to phase out the remaining 8 artificial dyes from America's food supply. The health secretary proposing to eliminate the petroleum-based dyes that are found in things like cereal, ice cream, snacks, and more. And he wants this done within 2 years. The secretary making the announcement in Washington. And here's what he said just a short time ago.
I was talking with my staff about these petroleum-based dyes, and I said if they want to add petroleum, if they want to eat petroleum, they ought to add it themselves at home. But they shouldn't be feeding it to the rest of us.
Well, ABC News medical correspondent Dr. Darian Sutton is joining us with the latest. I mean, it's a little bit hard to argue with that argument, but Dr. Sutton, it sounds like, again, they want to eliminate some of these things from this food supply, some of them by the end of next year. That includes some of these more specific dyes, and that's really quick, right, for them to eliminate that within a year, the rest within 2 years. What should Americans be looking out for in the meantime?
It's incredibly quick. You know, food dyes are in a majority of products, or a lot of products, I should say. There was a Wall Street Journal analysis that found that 1 out of 10 products within supermarkets have some type of food dye in them. Of those products, Kana, at least 40% have 3 dyes or more. So this would be an incredible task to take on, trying to expedite this process. He even stated that red dye number 3, which was banned during the prior Biden administration, which has a goal to roll out in 2027, he had a goal to expedite that or move that into a quicker process. So all of that being said, it's a long regulatory process in order to take these products or these additives out of these food products that involves many stakeholders, not just the FDA, but also manufacturers as well as consumer health advocates.
And what are the concerns over the dyes generally?
So this is based on studies, and when we look at these studies, albeit they are smaller and some of them are older, they are animal studies that show that food dyes have been associated to outcomes such as cancer. The FDA maintains that these studies have not shown conclusive evidence that shows that harm can be affected in humans, but the FDA does also state that some children might have sensitivities. There are other studies that show that food dyes have been associated with behavioral changes, even hyperactivity, as well as even cases of allergies and irritable bowel disease. With that being said, these studies are still not fully conclusive. They're relatively small, and they don't tell the whole picture. But many health advocates are stating, oh, if there is any risk at all, why take that risk, given that there's no significant or no benefit at all by adding these food additives other than making products look better?
Well, I mean, these dyes have been in our food for years, right? They were approved in the first place. How does that happen, and how do they try to establish this national standard now in a new timeline?
Yeah, this has been decades long of a push from these health advocates that have been making sure that we are well aware of this information regarding the studies that have shown the associations with poor outcomes in terms of hyperactivity, behavior changes, and even, again, as I said, allergies and irritable bowel disease. Now, with that being said, the process of taking these food dyes out can be quite tremendous. When you look at the overall evidence, it is difficult to say a clear cause and effect, but if there is no clear benefit when adding something like a food additive other than making food look better, then many argue, let's just simply take it out. But that likely will take years, if not more, to fully roll out. If you're trying to make decisions for yourself and your family, the best advice is to look at the food label. All ingredients are listed in that food label. That is what we can trust on. And you want to make sure that if you want to avoid food dyes or artificial food additives, you can choose an easier route to pick organic foods. And then, of course, choosing whole foods over ultra-processed foods. And again, teaching your children is really important to read those food labels, making them savvy consumers so that when they're going around the supermarket by themselves, they can make better and healthier choices.
Yeah, that's smart. What's the rule? You shop on the outside of the aisles at the grocery store and not down the middle where the snacks are. Dr.
Exactly.
All right, Dr. Sutton, thank you so much for being on with us today. We always appreciate you.